Hard to believe Valentine's Day coming up on Friday. A lot of emphasis and attention going to be paid to matters of the heart this week. Certainly that is the case over at CHI Memorial and their cardiac rehab program. Matt Thomas joins us this morning. He's the manager there at the program, and this happens to be Heart Week, so good to see you.
Yeah, thanks for having me. Good to be here.
I'm glad to have the chance to talk to you because we really were chatting. You were giving me a bit of an education this morning, and you were sharing with me that the program really at Memorial has kind of 3 phases. So for many people watching, if they've had a heart condition where they were treated at the hospital, they may have seen you or your staff.
Yeah, there's a good chance of it. And as we were saying, we have 3 phases of programming, phase 1, 2, and 3. And phase 1 happens at the bedside. So very much if someone has had a qualifying procedure, a heart attack, stents placed, open heart procedures, then we've seen them. Like we were kind of teasing, they're stuck in the room, so we come and give them the education and get to work with them a bit.
All of us, human nature is that you want to feel better and you want to think that you're better. So many people go home after getting that initial hands-on care in the hospital and you begin to mend. So you think, oh, I'm good, I don't need that anymore. Just the opposite is true.
Yeah, and we make a lot of comparisons in cardiac rehab to things like physical therapy, other outpatient services. But what's unique with cardiac rehab is many times you've had a condition that's been going on for years and there's been a slow decline. Then all of a sudden you go into the hospital, you have a new stent placed, more blood's back to your heart, and immediately when you leave you're feeling much better. And it's very easy to think that your care and your healing ends there. But our real role is to work on fundamentally education as well as monitored exercise. So we like to kind of think of 3 phases of our care. 1, we are giving treatment. We're making sure that the heart has the best environment for healing. Secondly, we're also working on decreasing the risk of a future event, because after you've had risk factors, whatever it is that brought you there in the first place, you're more likely to have another event. And the final thing we do is really just give you peace of mind to get back into the activities that you need and want to do and demonstrate that you're capable.
That part I think is so significant, because if you've ever known anyone who had even a heart scare, it's part of the recovery is mental, because you're afraid of every little thing you feel.
Yeah,
right?
Absolutely. And that is a big component of it. You know, we have plenty of patients that really come in and within the first 2 to 3 weeks are feeling pretty vibrant, feeling pretty good about what they're doing, but showing them that, hey, you can jog on a treadmill again, you can lift weights, you can get back into activity. That really translates to the things, again, that they want to be doing, whether that's just activities of daily life, maintaining independence, or things that are a little more involved, going on hikes with the kids, grandkids, enjoying things like that.
So we're talking a lot about the heart side of things, but the actual official name is the cardiopulmonary rehabilitation program. So on the pulmonology side of it, that would incorporate things like COPD?
Yes, yeah. So there are, COPD is kind of an umbrella term for chronic illnesses, including the lungs, but we do see some other cases, things more specific like interstitial lung diseases, pulmonary fibroses, basically conditions that really diminish the lungs' capacity, and we focus, again, exercise and education to make that disease more manageable.
It makes sense with the heart because your heart's a muscle, so the more you exercise it in the right way, the stronger it's going to be. With your lungs, they're not muscle, are they? They're more fibrous?
Yeah, so it's a different tissue type. You're right, the heart will respond pretty quickly since it is a muscle, like any of the muscles that we train. When we condition them, they adapt. Lung diseases are a bit different in that the disease progression can sometimes be slower or faster, and really on that side of the equation, our focus is to slow the progression as best we can and really work the complementing systems in the body to make sure that if the lungs aren't as efficient maybe as they could be, that the rest of the supporting body parts, the muscles, the heart, they're as strong as they can be to really play a good, keen complement.
I've said this plenty of times before, y'all are probably sick of hearing me say it, but as a point of reference, I'm asthmatic, and I've had 3 times in my life where I've been hospitalized, once in the ICU. So when you can't breathe, if someone says to you, I want you to exercise, I mean, your immediate thought is no.
Yes.
You want to hold on to every bit of air you have coming in, but the truth is, that strengthens you, right?
Yeah, and I think that that's a really good point for both cardiac and pulmonary, really any chronic illness. When someone from our team approaches you and really promotes the idea that we're going to exercise, it's a very intimidating conversation to have, especially when you're in a vulnerable place. And that's probably why utilization is so low for these programs. Nationally, we see about 25% participation, and these are programs that are reimbursed by insurance, so participation should be higher, knowing what we know about the outcomes later on. But it is an intimidating thing to be told when you're feeling not so well in a hospital bed that we're going to do a supervised exercise program. Yeah, it could be kind of a tough pill to swallow.
But if you can just trust them and know that they have these expert eyes on you, you will end 2020 feeling so much stronger and knowing that you have the reassurance that you're doing it the right way. You can find them at Memorial's main office there in the Glenwood area. Memorial.org is the website. The phone number 495-7764. Matt, thank you.
Okay, thank you. Appreciate it.